So how after 3 months after tearing my quad off of my knee did I go to the gym this morning, no brace, after a surgery I just had 3 months ago? Well, let's go back a few months. July 3rd when the rains happened in Austin, Texas, I was about to go on my family vacation, walked out from under my garage onto a very steep driveway. One leg went out from under me, the other one went underneath me, and snapped. There went the quad, the patella tendon completely severed from the quad, and also shredded the middle head. So I thought, this could not have been worse timing, right? But am I gonna mope in Austin? No, we don't mope in Austin. We're going on ahead and went to our vacation. I thought I'll give them a call on Monday, them being my surgeon, who I unfortunately know because they've cut on me another 5 times before this, but so I know my surgeon. So I call their office on Monday, asked them what can I do? Do I stay the rest of the week or do I need to come back? They said, no, you need to come back. We need to cut on you this week. We need to get you in for surgery with the doctor. Let's get this done. Let's attack it because next week he goes on vacation. So we're working with a time frame here. So I came back short for my vacation, had my surgery scheduled on July 14th, which is now 3 months ago yesterday. And in 3 months, I'm back in the gym. No brace. I actually got to drop my brace 7.5 weeks after surgery. And how's that all possible? Well, I know y'all hear me talk about everything that we do. Well, let's go back to when we started with CryoFit and cryotherapy in 2014. The first 35 surgeries that we followed with just cryotherapy, all orthopedic, all 35 of those surgeries beat the surgeon's timeline. Not 34, not 33, all 35 of our surgeries that we tracked beat the surgeon's timeline. That's a pretty big deal. We were pretty certain that we had our methods down, our protocols down. It wasn't an accident at that point. We knew we had something. Well, I hadn't tracked anything in a few years. I'm sitting there, scratching my head going, okay, why did this have happened to me? Just tearing my quad. I'm a very active person. I was looking forward to this vacation like you wouldn't believe from months prior. I was going to be active with my family, and all of a sudden that was taken out from under me with one quick slip. And all of a sudden I thought, why is this happening to me? Maybe I'm supposed to be documenting this. Maybe I'm supposed to take a step back and look at what CryoFit has now evolved into BioWorks, where we do a whole lot more than just cryotherapy. We have 10 or 11 modalities depending on which location you're at, all centering around getting the body's inflammation down, circulation improved, and now we actually have an entire line of regenerative therapies, and that's why this is important, guys. So what I was dealing with the tear, lots of pain. I won't lie to you and tell you this wasn't painful. The most pain I've had in a long time. Such a big muscle, and what was the protocol and the plan? Staple it back to my knee, and one orthopedic surgeon through my brother-in-law's conversation had told me, you're looking at 5 to 7 weeks of immobility. And I thought, not me. That's not who I can be. I got to sweat. I got to get out there and be active. I can't sit there for 5 to 7 weeks and be immobile. I took that story to my surgeon when I had my pre-op appointment, and he turned around and looked at me, and I won't ever forget the look on his face. He said, you want to get aggressive? And I said, hell yeah, I want to get aggressive. I got a music festival at the end of October with my wife. The goal is no brace, having a lot of fun, doing it, and crushing it. Not just going and kind of walking through it, but really having a good time and enjoying life like that. That was the goal. Well, at my age, at 55, the average time would have been 24 weeks for a repair. Before the surgery, I thought, well, now we're going to put cryotherapy, of course, because we're good at that, peptides, and now we're going to also add exosomes, which is some of our newer modalities, all centering around regenerative therapies, all centering around regenerating tissue after an injury. So knowing what I was going to do for my protocol was the day after surgery, I came back, we started cryotherapy, we started peptides, and that was the BPC 157 and TB 500 stack. It's very popular, along with cryotherapy. Both of those I was going to do 5 days a week out of 7. Let the body reset for 2 days and back at it. 9 days after my surgery, we incorporated one exosome IV drip therapy, and that is basically fuel to the cells to get that tissue regenerated. So where am I sitting? So I will tell you, I do every physical therapy appointment that I'm told to do. I do exercises that the physical therapist tells me to do at night, every single night, because I want to get myself back in the game. I need to be back in life. I'm not good sitting on the sidelines. So as we progressed through this, I was in the cryo chamber the next day and started my peptide therapy. As the weeks progressed, at 7.5 weeks, I was able to drop my brace, which was amazing for me because it hurt more to wear the brace than to not wear the brace, but you can't be foolish and do things carelessly. We have to follow doctor's orders and physical therapist orders. They allowed me to take off my brace at 7.5 weeks because the inflammation had gone down, the incision looked amazing, and my flexion points were already past 90 degrees at 7.5 weeks, far ahead of schedule. Y'all hear me talk about this to you guys all the time. I do my own walk too, and now we're looking at 3.5 months. I'm back in the gym today, no brace, going pretty much full out, burned over 600 calories in 55 minutes, back in the game. I'm not good, like I said, at sitting on the sidelines. So when you're looking at how you're going to deal with injuries in your life, when you're looking at time that's going to be out of your normal schedules and what you're used to in life, look at what you have access to these days. These days, there's so much more advancement in recovery that a place like Bioworks is a place for you to go to when you're sitting there looking at something that's going to take you out of your daily regimen, take you out of your game. We're here to get you back in the game. We don't do small recoveries, we do big recoveries, all right? I'm proof of that, and like I said, we're going to be dropping full-on release in 1 more month. I'm calling it right now, 16 weeks versus 24 weeks. The surgeons will be releasing me. I can already feel it because I know what I'm already able to do. The physical therapist is seeing what I'm able to do. This past Monday, my knee flexion was at 137 degrees. It was the same on my left leg that was the non-surgery leg. So in life, throws a big curveball at you like it did with me. Come see us. You do not have to sit on the sidelines. You do not have to take long periods of time out. We have ways to speed your recovery processes up by doing it with your own natural healing mechanisms in your body and unlocking those. Come see us. Bioworks is your answer.